I'm Laura Bonnell, and this is the Living with Cystic Fibrosis podcast coming to you from Detroit. Please subscribe and even rate and comment on our podcasts when it moves you. I learn something new with every podcast, and I'm always inspired by the people that are showcased here. We don't give medical advice. You need to connect with your doctor for that. I hope that this Living with Cystic Fibrosis podcast educates you and sparks some volunteering or advocacy. The CF community needs people like you. Thanks to our sponsors, Viatris and Vertex, for their support. Dr. MeiLan Han, a true leader in the field of pulmonary medicine and a passionate advocate for people living with chronic lung disease, Dr. Han is a professor of medicine and chief of the Division of Pulmonary and Critical Care at the University of Michigan Health System. She spent her career pushing the boundaries of how we understand, diagnose, and treat respiratory conditions like COPD, and her insights have big implications for the cystic fibrosis community and beyond. She's earned her medical degree from the University of Washington in Seattle, and then she completed both her residency and fellowship at the University of Michigan. She's also earned a master's in biostatistics and clinical study design, giving her the tools to lead groundbreaking research. Dr. Han's work centers on using imaging to identify different phenotypes of COPD, essentially different subtypes of the disease, which is paving the way for more personalized and effective care. She also leads major NIH-funded studies. Dr. Han is the deputy editor for the American Journal of Respiratory and Critical Care Medicine, where she helps guide the future of respiratory research. She's got a long resume. She has done so much. Dr. Han brings together clinical excellence, research, innovation, and a heartfelt commitment to patients. And if you or someone you love is living with cystic fibrosis or any lung condition, you'll want to stick around for this powerful conversation because she has a lot to say. So, Dr. MeiLan Han, thank you so much for joining us. I was delighted to come across your book, and as I just showed you, I have marked it up. I've read it cover to cover, and I didn't think it was possible to learn new things because I felt like I know so much about cystic fibrosis, but I did. So thank you.
Well, thank you for your interest. I love that you love it. It was kind of a passion project for me, written during the pandemic, and I'm always happy that someone might be helped by it.
Yeah, and I am excited. You know, we talked all about you in the introduction, but I told Dr. Samia Nasser, like, hey, guess who I'm doing a podcast with? And we were just in Egypt meeting with cystic fibrosis families there. She was like, oh, yeah, you know, that's great. So it's such a small community, the pulmonary community and the cystic fibrosis community. I just want to start by asking you, because so much is going on with research and everything, and you've worked with the NIH. What continues to be like what you want to see as far as lung research in the future going forward?
I have to admit, it's very difficult for me to kind of wrap my head around what's going on at the federal level right now with kind of the crumbling infrastructure for research and innovation in this country and funding for science, generally speaking. It's a very, very difficult time, I think, right now for patients as they think about the future, for doctors as they're trying to keep their programs together. There's a lot of things I would love to see happen, but right now many of us are just scrambling to try to figure out how to hold our programs together due to the funding cuts. So one of the amazing things that had happened a few years ago was that the NIH and American Lung Association finally funded something called the Lung Health Cohort, which, as you know, I talk about in the book. We really are thinking about the lungs and lung health, more generally speaking, as something that starts really in the womb. And so we need much more longitudinal information than we have to really understand what's normal and healthy and understand trajectories. And just like our kids get growth measured against growth charts when they grow up, we just never measure lung function. And so it was so exciting when this study got funded because they finally were investing in a young cohort, individuals sort of in the 25 to 35-year-old age range to just, community dwelling individuals, get them in, measure their lung function, get some CT scans to help us understand just more about what healthy and unhealthy looks like. But that study was always intended to be longitudinal. We've just about got the first baseline visits done, although unfortunately recruitment was impaired because of the pandemic. But the future of that study and whether it will be able to be longitudinal right now is very much a big question mark. That's, just one of the many things that I worry about is that some of the good work that we had started, we may not ultimately be able to use that data in the way it was originally intended. So there's a lot of things I'm worried about right now.
There is definitely a lot to worry about. And one of the things is I guess I'm not surprised. I'm not surprised on one hand, and then I completely am on another hand. I was in Vegas for a conference, as you know, yesterday, and there's smoking in the hotels. And I mean, it's a casino that, they're everywhere there, obviously. But even the vaping, that people aren't getting the message that they're going to need lung transplants. So how are you seeing that fewer people are starting to do that, or is it still increasing?
I think, and I could be wrong on this, but last time I looked at the data, I think the number of youth that are vaping has evened off, but it's still a significant number. And one of the things that's concerning to me is, it's hard because vaping hasn't been around as long as, say, conventional cigarettes. And so we don't have, as much of that longitudinal data. But what I will tell you is that I've been looking at a lot of these CAT scans that we have obtained from the lung health study. And I've been seeing changes on them that I would have associated with cigarette smoking, inflammation, and kind of early signs of lung damage. And so I've been calling these patients, asking to find out what they're doing and telling them to stop, because I can see that there's growing damage. And was surprised that the answers I got were vaping or marijuana.
Wow.
And the thing is, we don't normally check. There's no reason a otherwise healthy 25, 35-year-old would get a CAT scan. But now that we are checking, at least as far as the study, I've definitely been concerned about, what I've been seeing. And I think there is sort of this false message out there that it's safe, that all of these behaviors are safe. But I think from a common sense perspective, what did we think was going to happen when you inhale noxious particles into your lungs on a daily basis? So, I am worried about that the harms for activities like that are going unnoticed. And unfortunately, they may not notice it in their 25, when they're 25 or 35, because as you know from the book, the lungs are fairly resilient, but then they could get into trouble later. We just don't have that longer term data yet. But at least what I've seen so far, I'm definitely concerned.
And the Surgeon General, I mean, is anyone reading that on the cigarettes? I just don't think when you're buying cigarettes, you've made up your mind already.
Kind of like the warning on alcohol, right? You're like,
right.
Okay, yeah.
Unless there's like public service announcements and education and really some huge campaign, I don't think that message from the Surgeon General is deterring anyone. So you're right. You're not checking on someone's, quote, healthy lungs until there's a problem. And then you've got a problem.
Yeah, one of the things that I do, I'm currently working with GOLD, which stands for Global Obstructive Lung Disease. And we kind of oversee the international recommendations for COPD. It's not CF, but another obstructive lung disease. But one of the things I'm working on, it's not done yet, but I'm working on a document that's going to call for universal spirometry in early adulthood. And, one of the challenges that we've had is that the U.S. Preventive Services Task Force, which kind of oversees how guidelines are implemented and screening in particular in this country, held a pretty strict line about screening with spirometry because their argument has been, at least for COPD, that there's no evidence that it impacts longer term outcomes. But my thought is that we need to stop thinking about it maybe in those terms and maybe start thinking about it as, we're finding one point in time very difficult to interpret, and that we actually need multiple points in time to understand the slope of lung function, kind of like that growth chart. And so I think we simply need it for diagnostic purposes down the road if somebody were to develop symptoms, to better understand, did they have impaired growth as a child, or did something happen in adulthood? And without that information, it's very difficult to try to fully understand what's going on with someone. And I think the other thing that is lost is that, we say, well, okay, physicians wouldn't do anything, but maybe if patients would behave differently. So I'll give you an example. A few years ago, saw a young person in my office that came in with their mom, and they were having a difficult time playing basketball with their buddies. They were, a young adult at this point and just could not catch their breath, and, had started vaping, and mom was worried about what was going on. So he was hauled into the office. And when I explored with him further, it turns out that he had been born prematurely, had been on and off oxygen in the first couple years of life, and then sort of got lost to follow-up. Thought he was, they thought, okay, well, he's okay. But it turns out he probably had significant lung damage as an infant. It had sort of not been followed. And then on top of that, he was adding additional insults with what unfortunately are kind of common teenage behaviors. But, he might have made different choices with his life, right?
Right, if he
about
knew.
being,
Mm-hmm.
if he knew, but he didn't know. So I have to believe people might make different choices about occupations, what risks they're willing to play with their health, if they, knew that, they had, say, impaired lung function coming into adulthood. And I think that's the big fallacy. When I started medical school and as a young pulmonologist, we had this thought, and I don't know why we thought this, but we just did. We just kind of had this impression that everybody entered adulthood with healthy lungs. And if they were unhealthy, you would know it because something, there would be something in the medical record you would just know. So we just assumed everyone starts out healthy, and then there's this kind of rapid decline if there's some problem. But I think now we're realizing that, just like height and everything else, that actually a lot of people are entering adulthood where something bad has happened, severe respiratory infections, or maybe a genetic condition nobody ever picked up on. And we can't really assume that everyone's got quote unquote healthy lungs coming into adulthood. So that's part of the reason why we'll see what happens. I don't know how successful it's going to be, but I'm going to do my best to push for us starting to just measure lung function more routinely.
I think it's a great idea, and it's so interesting. Obviously, the cystic fibrosis community knows the importance of it, but talk about the importance of lung health, which you're trying to teach to everyone, because I think you're right. As you said in the book, people don't think about it, but you've described the lungs beautifully in so many different ways throughout the book, and the importance of them and all that they do.
So, lung health isn't something we typically think about, is it? Right. So
Right.
Heart health, I think, has kind of become a thing, but we talk about lung health less. And, I kind of hypothesize and think about it a little bit in the book, but even if you think about how doctors code, right, and why people go to the doctors, maybe for children we do well child checks, right? But pretty much otherwise, every single ICD-10 code that a physician uses is typically some disease diagnosis code, right? Not a health diagnosis code. And so that's just the way we're wired. It's the way we bill. It's the way, physicians are taught to think. But I think if we ultimately, want to have healthy people and healthy populations, maybe we need to start flipping the script a little bit and thinking about, health and how do we preserve health, and with increasing respiratory health with the environment, increasing wildfires, climate change, vaping, as we were talking about. There's so many things, new respiratory infections that are popping up. I think it helps to think more about how do we just protect our lungs on a daily basis. What are those things that we can do to preserve that health? Like we think about, okay, I need to exercise to stay healthy for heart health. Well, what are the things that I need to do to maintain lung health? Because I ultimately think those will be keys to longevity.
And you talk about breathing techniques. I mean, that's how you can calm yourself doing things like that. Are those some techniques that you're also telling people so they kind of have an idea of how to take better care of their lungs as well?
So breathing exercises, I think, have a role, particularly for patients with lung disease, and particularly those with respiratory muscle weakness or just generalized systemic muscle weakness issues. Pursed lip breathing can be a really effective technique for patients with airflow obstruction because it can help to pop open those small airways, and it can be kind of a relaxing maneuver. But when I think about how we protect the lungs, I really think about it honestly, starting from the womb, kind of all the way through adulthood. So it's moms not smoking, moms not being exposed to air pollution. It's babies that are getting their vaccines and being protected from respiratory infections. And fortunately, within the last few years, we've had amazing strides with like RSV, for instance. Mm-hmm. There's so much better protection for moms and babies out there now than we had years ago. But there's even data that children, when playgrounds and schools are near freeways, children will have more asthma exacerbations, impaired lung function, and that when those schools or children are moved away from the traffic pollution, that lung function actually improves and the respiratory health of children improves. There's so many things, even from like a policy perspective. Individuals that are living in multi-family housing units, and trying to keep, as it's impossible to keep the smoke in just one apartment right. unit. So trying to, it even comes to things like that, like, like city policy, city, structural planning. And then, all the way up into, adulthood, when we think about, occupational exposures, environmental exposures, like what just happened in LA with the wildfires. It's not just stuff that happens in the doctor's office. There's so much other stuff we have to think about when we think about protecting, lung health over the life course.
And if there was maybe one or two things that you could tell people to do to keep their lungs healthy, what would those be?
So there's a couple of things. One kind of analogy I like to use is that, if you're going to go out and do something messy or dirty, work in the garden, clean your garage or whatever, we always put on gloves, right? To your hands. Well, the thing to remember is that we don't have a really good way to wash out the lungs. And yes, there are protective mechanisms, as you know, like in cystic fibrosis, which we talk about the cilia a lot. But there's only so much clearing capacity that even healthy lungs have. And what's interesting is part of my research involves, taking lungs that came from gift of life or at the time of transplant. And what's shocking is just even in a quote unquote healthy lung, how much black pigment you will see, even in a healthy young adult. So there's clearly, if I can just see it with my own two eyes, no microscope, there's a lot that the lungs actually cannot clear. So one thing I just advise people about is just try to be mindful about the air that you're breathing. If you are going to be going out and cleaning your garage, or you're, changing toner in the printer or the copier at work, like think about the aerosols that can be kicked up, and, be careful, wear a mask. It's also about preventing respiratory infections. So that's, getting the appropriate, vaccines. There is some data, interestingly, to suggest that exercise can be protective for lung health. So there was an NIH-funded study called Cardia that was actually primarily supposed to be looking at heart health, but they were able to get some money to add on some pulmonary function testing. And what they found was that lung function among people later in life was greatest among those who had highest baseline exercise capacity. And those who maintained exercise capacity over their life course and possibly even improved had the best lung function later in life. Now, what we don't know is whether, some lung function, it does depend on just the respiratory muscles and the skeletal girdle that surrounds the lungs. So we don't know if it's just those people were stronger and fitter and could blow harder, or is it possible, as some have hypothesized, that the exercise actually has an anti-inflammatory effect that could be protective for lung health. So we don't know. But I think, some of the things that we think about as being protective for heart health, again, like exercise, probably are also protective for lung health.
Very interesting. And I know, in the CF world, we're very aware of pneumonia and what it can do to the lungs. But I think sometimes people who have no health or no lung knowledge, if they get pneumonia, they either think it's not a big deal, don't take it seriously, and then they're hospitalized and so sick and almost die. And I think everybody needs exactly what you're doing, is more education on how to keep their lungs healthy.
So one of the most interesting pieces of research that came out of the pandemic, to me anyway, was this study that looked at wildfires in the American Northwest. I think it was the first summer of COVID. And what they found was that people that were, who lived in Oregon that had been exposed to this awful air pollution from the wildfires, it was a very interesting time because we were at the same time both tracking air pollution and COVID at the same time in a very, very granular way. And what they found was that there were more COVID cases and more COVID deaths among people that were exposed to the air pollution. And so what that suggests to me is, first of all, that, there are things in the environment like air pollution that probably are causing inflammation and impairing the lungs' ability to fight infection. And there certainly is other data on this. This is just an excellent example, and I think really easy for the public to understand. But it also suggests to me that many of us are probably, our susceptibility to things like infection and getting pneumonia probably wavers over time, right? And it's so interrelated. So it could be you breathed in something, you went to a concert, a smoky concert or something, and you didn't think about all the stuff that you were exposed to there. And then you get exposed to a virus, or maybe there's something at work that you're getting exposed to chronically or in the home. And unfortunately, for some patients, they actually never really fully get over those pneumonias. And I can still see residual scarring in the lung. And it also, I think, kind of just speaks to how silent the lungs can be. And so, our lung health probably fluctuates up and down quite a bit without us actually knowing it. And I actually think that either temporary or maybe more smoldering undiagnosed lung inflammation may contribute to some of the huge variations we saw in how sick people got during the COVID pandemic. Because I think many of us were sort of trying, like, why did this person do fine?
Right.
And this person, who I thought was totally healthy, almost died. And it probably doesn't explain all of it, but I think it explains some of it, based on some of the literature that I saw coming out of COVID, which again, I think just speaks to this general concept that most of us don't actually know at any given time how healthy or unhealthy our lungs actually are.
It's so interesting. And we haven't even touched on half the stuff that's in your book. What are some of the more exciting things, maybe that we didn't touch about yet, that you found and included in the book about lung health?
So there's a lot in there about the biology and trying to help people understand. And I kind of walk people through just a little bit about, how the lungs work and the blood circulation and when things go wrong, how we investigate. But to be honest, for me, one of the most fun things to research in the book was actually the last chapter, which was the history of kind of how we got to this moment in time. And I researched the history of heart health, and I researched the history of lung health, and then I compared them to try to put them into historical context to understand kind of like, sort of like a tale of two cities, or, two roads diverged in the wood. Like, why do we have a blood pressure cuff in every single doctor's office in America? and maybe we're lucky to see a spirometer. Why is that? So here's what I found. So when we go back to the early origins of the spirometer, the original machine was actually a bell inverted in water. And patients would blow into it, and the amount of water displaced measured something that a gentleman named John Hutchinson, who is actually a life assessor for a life insurance company. He was like a physician / insurance assessor in the UK. And he named this displaced amount of water, he named it vital capacity. And he found that vital capacity predicted longevity. And he was so excited about his finding that he was sure that every life insurance company in the UK was going to latch onto this technology. But they didn't. And he ended up dying in obscurity in Fiji.
Wow.
And so when I think about it, it probably had something to do with the fact that the machine was like not portable.
Okay.
And probably not super easily reproducible. And so when we compare that to the blood pressure cuff, and particularly when that was then combined with auscultation, so doctors could find systolic and diastolic blood pressure, that could easily be put into a doctor's bag. And so you have to remember, in the early 1900s, we were living in an evidence-based medicine free zone. Like people just did stuff because they thought it worked, but it's not like we had large clinical trials. We didn't have all this data to suggest that blood pressure was important. But anyway, doctors just figured out that it made them look important. It was a skill that they could kind of sell to wealthy clients. And so they would put the equipment in their bag, and they would go and pedal themselves really to these wealthy clients. And so measuring blood pressure became very popular, even though I don't know that doctors really knew how important it was. And so the interesting thing is when FDR became president, his blood pressure by modern day standards was elevated. And throughout his presidency, it got increasingly elevated to the point when he finally died of a stroke and heart failure. It was like 300.
Wow.
And after he died, actually, and I think it may have been part of the trigger for this, Congress passed funding for what would become Framingham. Now, for people who don't know, who are listening, the Framingham study took place in Framingham, Massachusetts. It was close to Harvard. And the town and the mayor were willing to kind of be guinea pigs for these Harvard scientists. And it is probably the most important epidemiologic study that has ever been conducted, because that is how we figured out the importance of blood pressure and obesity and all of these things, cholesterol, all of these things that we now know are so important for heart health. And the upshot of that is that in the last 50 years, mortality from heart disease has plummeted because we could measure these things, we understood their importance, then we could develop targeted treatments, right? But at the same time, we never, lung health really didn't gain importance until finally there were enough kind of people who are in factories were exposed to occupational hazards that we finally figured out, okay, maybe we need to start at least figure out how to measure lung health, at least in these certain conditions. So the technology finally evolved a little bit. And then ultimately, modern pulmonary medicine was actually driven more by, which is interesting because it's currently making a resurgence, tuberculosis. So for instance, the American Thoracic Society was originally kind of, formed around fighting tuberculosis. Spirometry was kind of more of this niche thing that was more focused on, again, kind of occupational health hazards. And it wasn't really probably until the 60s and 70s when everything kind of merged into what we think about now as sort of how we conduct modern day pulmonary medicine, with pulmonary function being kind of more at the forefront. So we are just so far behind in how we think and measure respiratory health compared to heart health, but it has all these weird, I think, just kind of historical happenstances that kind of got us to this point.
It's very interesting, and you'll tell me what it's called, but I don't remember. It's not spirometer, but after you have surgery, sometimes they have you making sure that your lung capacity is good, right? So you don't get an infection. Is that something people should be doing every day? Little lung exercise?
So yeah, like incentive spirometry after. And so here's the thing. If the lungs are not getting fully expanded, right? So you're sitting around a lot, you're not getting up and walking around. That atelectatic lung, which is what we call kind of squished lung that's not getting well aerated, can set you up for infection. And so when you have a patient who's recovering, they're splinting because of pain, they're not going to be up, walking around and taking good deep breaths. And so that's why we encourage that. If you're out and you're kind of living your daily life and you're going up and down the stairs in your home and you're going to the grocery store, you're probably getting enough of that normal, just that physical activity causes you to take a deep breath. And I don't think it's quite so important. It's really more important for patients that have impaired mobility that aren't taking those kind of normal breaths that we associate with everyday living. So that's why we really focus on that post-op population for trying to help them take deep breaths.
And when you referred to JFK and Jackie Kennedy losing their son to a lung disease, was this, I can't recall, were you trying to remind people that there are many different lung diseases and they also help raise awareness when their son died from a lung disease?
So their son had, developed respiratory distress syndrome in infancy, and now we actually have a treatment for it, which is surfactant. I think there's a lot of things that we can learn for that story. One of them is that we always think about children as they're born or babies as being like fully developed in some way, like ready to meet the world, right?
Mm-hmm.
But it turns out the lungs are like kind of the last thing to develop and are kind of finishing development as we're born. And one of the things that they absolutely need to be able for the little, the alveoli, the air sacs to pop open is this kind of magic substance called surfactant, which is like a soap-like substance that reduces the surface tension. And it turns out that develops more quickly in girls than in boys. So it's, I actually, and this is a story for another time, but my son was born premature. And so one of the things that we've found over time is that steroids, and this was NIH, this is why NIH-funded studies are so important, but the NIH helped to fund the research that helped us to understand a lot of this stuff, is that steroids can help speed lung development. This is, again, particularly important for boy infants. And so they knew my pregnancy was at risk. I got steroids, several doses ahead of time to try to speed development of his lungs so that he would be ready to meet the world. And I was really fortunate that he did not end up on a ventilator, but they were worried he was going to end up on a ventilator. So now we know, we have all this information now. We know we can give steroids to speed lung development. We know that that's what we have to worry about. We have medications if there are, babies. We know how to better support the lungs of newborns. So I think there's kind of a lot nestled in there, but it also just, I think, points to how vulnerable the lungs of babies are, and why I think about lung health, again, starting in the womb. There's so much that's happening there. The other thing that I think people don't realize is that the lungs are not fully developed until people are around the age of 25.
Everybody thinks of the brain and talks about the brain, and especially boys' brains, and when they're developed.
I wish there was something to speed the development of boy brains. I keep telling my son I'm his surrogate frontal lobe, but yeah. So when we think about vaping, and when we start letting people smoke cigarettes, and we think about legislation around that, we have to remember their lungs are not adults really until their mid-20s, and we need to be thinking about how to protect, lungs through that entire development period.
And that's why so many different things are so important. I mean, from the catalytic converter, right, to cigarette smoking, to climate change, to everything that we talk about. I also loved 600 million breaths in a lifetime, you said. Wow. That honestly doesn't seem like enough. Like how long are you living if if that's what you've had, because I would like to be 120, honestly.
You might get a few more breaths in, but yeah, I think it's funny. I haven't actually thought about the book in a while, but I think in the book I refer to it as the unapplauded marathon. So, right? I mean, we don't
Yeah.
think about really like what we're expecting our lungs to do from birth until, hopefully most of us make it to 80, 90, 100.
Right.
And that's why it's, when you think about like, I don't know, think about your car, right? When you buy your car and some people, and I tend to be in this category, you're like, okay, I get to get this car to last like 10 years. My brother actually has a car that's 20 years old, right?
Nice. Impressive.
But you have to think about okay, these have to last me. And again, with sort of all of the increasing threats, it's so easy not to think about because when there's not a problem, you don't think about it. But again, as I talk about in the book, unfortunately, there can be a lot of accumulating damage that's really silent. It is so common for patients to come into my office and say, I don't understand. I was fine in February and in March, I got sick and I haven't been able to recover. And when I look under the covers to try to figure out what's going on, turns out they have some chronic lung problem that did not start in February. It actually probably started 10 years ago. It's just it finally hit this point where they crossed the threshold from not being able to cope with or, compensate. And then suddenly they cannot compensate anymore.
And anyone with cystic fibrosis can tell you, I mean, that's one thing we used to always say to the girls, probably too much, but that was kind of our mantra. We had to keep those lungs healthy. We had to keep the lungs healthy until we got a modulator, because whatever you came in with when the modulator finally happened, whether it was you, if your lungs were bad and you had scar tissue, that's where you started. So it was constantly, got to protect those lungs, got to keep those lungs healthy as we can so that when the drug comes out, you've got a good chance. And fortunately for us, it worked. It's so important. And people, I think, we just take stuff for granted when we don't have things
going on. Yeah. There's many other things to worry about.
Yeah. But your book is fabulous. Breathing Lessons, A Doctor's Guide to Lung Health. There it is. It's great. It's a great book. Dr. MeiLan Han. I really enjoyed it, and I'm so glad we got to talk. So thank you. And if there's anything else you want to add while we wrap it up here, please do.
Honestly, while this is not something I probably would have said 6 months ago, if people who are listening care about health, if they care about breakthroughs, if they care about things like the modulators that are now available, if they care about the fact that the U.S. has always been at the forefront of science, I think the one thing I would hope people would remember, the only reason we have breakthroughs, the only reason we have doctors who are experts in any particular area, like myself, is because of the NIH. And it's because of that funding. It's not going to happen in any other way. I mean, CF is an amazing example, but even the development of the modulators, stands on years and years and years of basic science research, right?
Years and years, and every time they got better and better and better, and it helped sickle cell, and it helped the vaccines, and then the vaccines, everything
right. So
is piggybacked on everything else.
And pharma is not going to fund the most basic science. And some of the clinical trials we need that the NIH will. And without that, I know it seems so distant for most of us, like, oh, well, okay, if that goes away, I'm still going to be fine. But our kids may not be fine.
Right. And I really think, I mean, tell me if I'm wrong, but isn't it going to stop the trajectory for cures?
Absolutely.
I mean, for cancer, for cystic fibrosis?
Absolutely. We were, maybe still are, the world leader. And everyone, kind of depended on us. And to be honest with you, I'm absolutely frightened about what's happening. So what is happening in Washington right now is going to have an impact on patients. So if I would leave anyone with a final thought, it's just, we have to work with our patient groups. We have to work with our our legislators to try to try to preserve the foundation we have in this country for medical research.
Yeah, it's critically important. I mean, simple as that. Saving lives. So thank you for being a part of that and for sharing your story and your passion about it all.
Well, thank you so much for all you do. I appreciate being here.
The original music in this podcast is performed by Kevin Allen,
It's not complicated.
who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, The Science of Possibility, and Viatris. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.